I'm Franco Cappuccio, Professor of Cardiovascular Medicine and Epidemiology at the University of Warwick, and I'm also a consultant physician running a hypertension clinic in Coventry. I want to talk to you about one of the emerging aspects in the clinical practice of hypertension, and then the importance of sleep disturbances in assessing the risk of hypertension and also the consequences and the prevention of complications in patients who do suffer from sleep problems alongside high blood pressure. We all sleep, and this is a part of our life. In fact, we spend a third of our life asleep, and yet very little has been done until recently to investigate what happens when we have problems with our sleep. Sleep disturbances of quality and quantity, in other words, how well you sleep and how much you sleep, have become an increasing problem in a modern society, leading mainly to the pressure of the 24/7 society, asking us to pack more in our daily life and basically trading off our single more precious time, which is the time we spend asleep. And there is quite a great concern that over the last 100 years, we have collectively around the world lost more than 2 hours of sleep per night on average, which is a lot. So the epidemiology of sleep disturbances, first of all, tend to suggest that the less we sleep, the more likely we are to develop short-term problems and conditions of which we are all aware of. You always had a bad night's sleep, and the following day you are tired, you lack concentration, you may want to catch up on sleep. That's what we call short-term consequences, which in general are temporary as long as your sleep reduction is temporary. But more recently, the problem of sustained, prolonged sleep deprivation is becoming a problem. And that has been clearly associated with the long-lasting consequences, among which some are very relevant to cardiovascular disease. In other words, if you have a sustained sleep loss, let's say over less than 5 hours per night on a sustained time, you tend to develop obesity more often, you are more likely to develop type 2 diabetes, you develop more hypertension. And you know how important hypertension is, for instance, at night, where you tend to reduce nocturnal dip and then increasing the risk of cardiovascular. And indeed, when you look at the effect on strokes, heart attacks, you find an increased risk of developing a stroke or a heart attack. So these are real problems that all become important now. How do we deal with that in practice? It's very difficult at the moment to have any tools that may prolong your sleeping time unless we act on the environment that allows us really to sacrifice our sleeping time. But there are a few tips that in practice we should learn. First of all, how many of you on a routine assessment of your patient tend to ask about the amount of sleep and the quality of sleep? We do ask about smoking, a level of exercise, maybe level of salt intake, but it's hardly anyone still concerned about sleep. And I think it is time that really we are proactive in probing patients to find out whether they have sleep disturbances, which could be the first hint into exploring the risk of cardiovascular events. The commonest problem in clinical medicine, however, is a condition which is becoming far more prevalent because it's more diagnosed, in fact, and that is the presence of obstructive sleep apnea syndrome. That is a condition that's been known for many years by respiratory physicians, but always relegated to the specialty and never expanded to other areas, including our areas of cardiovascular medicine. Sleep apnea syndrome is a condition whereby during night we have a repeated recurrence of either apneas, basically lack of breathing during night for a few seconds, or hypopnea of reduced oxygenation, which leads obviously to disrupted sleep. Hypoxia, a reduction in oxygen in your blood, and very often excessive daytime sleepiness with consequences in your daily life, including the driving risks and the risk of operating important risky machinery for occupational groups. But more importantly, obstructive sleep apnea syndrome is a powerful risk factor for the development of hypertension and cardiovascular disease. And the beauty of it is that once that has been diagnosed, there are effective ways of reducing the consequences and the symptoms of obstructive sleep apnea syndrome, and that by applying what we call continuous pressure airway treatment by or CPAP, which is a condition where you pump high pressure air through your airways, so to allow them not to collapse during night. And that collapsing of soft tissues in the airways is usually the cause of your having your apneas. So in terms of practicalities, it would be important for consultations to try and investigate the presence of disturbances of sleep of quantity and quality, either by addressing the lifestyle factors that individuals can correct by protecting their sleeping time, or if necessary, the investigations of other risk factor for sleep apnea syndrome, which very often is associated with high collar size, obesity, or hypertension, and refer it to the appropriate specialists.